Euthanasia is a topic that most people are uncomfortable talking about. What would be appropriate circumstances? Who would it be appropriate with? Is it ever an appropriate response to allow somebody to die? I'm credible to speak on this because I've done my research. I've also been one to see people be kept on life support for months or years after they no longer have a quality of life. My name is Eve Alexander. I want everybody to think about a few questions as I go through the information that I've gathered. 1. Is it responsible or moral to allow somebody undue suffering and pain? 2. What is the extent that life support should be used? And 3. Is it ever appropriate for euthanasia to be a part of the discussion? So the first question that you need to ask yourself is it responsible or moral to allow somebody to go through undue suffering and pain? Euthanasia is defined by Wikipedia as the practice of intentionally ending life to eliminate pain and suffering. The easiest way to imagine this is to think about a person with stage 4 cancer. There's no cure. Treatments will only extend life, but they come with intense side effects that take away from the quality of life. If this person no longer has a will to live and no quality of life left, then who are you to tell them that they don't have a right to make that decision? More likely than not, if a person cannot achieve a medically induced suicide, they will look into options that are more within their means, such as taking their own life. Now, rather than focusing on a more aggressive type of euthanasia, let's look at one that is a lot more common. The next question I want you to think about is, to what extent should life support be used? The University of Missouri's School of Medicine divides passive euthanasia as intentionally letting a patient die by withholding artificial life support, such as a ventilator or feeding tube. This is going to be a situation that is seen most commonly in the healthcare setting and in probably your own life. A lot of times there are elderly patients at the end of their life who may have a pacemaker or be on a ventilator. There are ways that the individual can combat artificial life support via a DNR or a DNI. Those stand for do not resuscitate and do not intubate. A DNI is seen less commonly than a DNR, but if you think about it, that person has no quality of life left. They've lived out 60, 70, 80 years. They've had a good life, so why should they sit and be in an extreme amount of pain, watching their family come in and out, day in and day out, when they know that they're not going to leave that hospital bed? It's a really upsetting situation, but technically when somebody's taken off life support because there's nothing left, it's euthanasia. And the third question I want you to think about is it ever appropriate for euthanasia to be part of the discussion? So I've heard from a lot of people during my life and in discussions about euthanasia that you're not God, you shouldn't assist in others dying, every resource needs to be used to keep a person alive. When thinking about that, I want you to think about the worst imaginable position that you could find yourself in. You've been on life support for 6 months. The multiple tests that all of the various doctors have done showed no brain activity. You've been classified as brain dead. All you have keeping you alive is the ventilator and the pacemaker that are sitting at your bedside. Your family still comes to visit you. They're being drug on day after day, seeing you basically as a corpse, sitting there when you're not coming back. There's nothing left inside of you except for a plethora of organs that hopefully can be used to assist somebody else that has a better chance of coming out of their situation. So my purpose for this is to just destigmatize euthanasia. I'm not going to lie, it's an extremely grim topic, but it's not one that needs to stay out of everybody's discussion about life. It's neither responsible nor moral to keep a person alive to suffer and be in pain for the rest of their time on this earth. And it's not ethical to use life support as the only means keeping somebody alive, like I've seen countless times. And it's not responsible to keep a family holding on to false hope and sitting beside a corpse day in and day out. The shell of a person is no longer that person. And I want you all to think about the possibilities that could arise, and not be afraid to make these difficult decisions, because honestly, the person hoping the right decision is made will eventually be you.